It's often better to prevent a disease than to treat it. That is what immunization is said to do for those who take them. The World Health Organization says immunization is among the most cost-effective public health interventions for reducing the death of children globally. In 2012 alone, 6.6 million children under 5 died from vaccine-preventable diseases, which include pneumonia, diarrhea, and measles. That is why this forum is deliberating on immunization in Nigeria and the impediments to its progress.
In most African countries, children are relegated to the background, and I think that's the problem we have. And therefore, until our government changes their attitude to say that they are there for the people, we're going to continue to have a problem. That's why in the issue of vaccine production, ideally for now, to be the best is to get the private people involved, but however, the government retains the position of maintaining the regulation and also the oversight.
We have been largely responsible for the failure to achieve the polio eradication initiative. We have consistently had the highest number of cases every year, and many cases even found in other countries have been traced to Nigeria. But this year we found that while Nigeria has 59 cases, Somalia has 180. And I say this is not good news because it means that the eradication program, which is a worldwide program, has been set back further, even beyond what Nigeria has done to stop it from being achieved.
Foreign donors and representatives across Africa were also present at the meeting organized by the Vaccines and Immunization Advisory Committee of the Nigerian Academy of Science.
Our mission is to save lives by increasing access to immunization. Nigeria has about a quarter of the birth cohort of Africa, so it's of strategic importance to us. We have committed about $700 million to Nigeria. We work with both government and civil society.
It's already politics correcting policy. If a proper budgeting has been done, and we say, okay, you have a cohort of 7 million children that are being born every year into the country, and they all have to be immunized. And some of them will also have other immunization that goes after 1 year. And now, without any justification, that money is just slashed. See, people will see it as slashing money, but really they are slashing the truths of women and children who will never get that vaccination.
The general consensus is that there is a need to scale up routine immunization for the protection of 7 million children born every year in Nigeria. It's been an exhaustive discussion without bias on the problems affecting routine immunization in Nigeria. Suggestions and recommendations are being put together in a communique, but whether they will be implemented or not is another story. Vivienne, Irikefe, TVC News, Abuja.